Hi, welcome to today's webinar, everyone. I'm Vicky Mansfield. I'm a Practice Development Officer at Emerging Minds. And first of all, I'd like to acknowledge the country that we all meet on today, and I'd like to pay respects to Aboriginal and Torres Strait Islander peoples, their ancestors, elders past and present and future, and to all the different First Nations across the country. I'd like to acknowledge the importance of connection to land, culture, spirituality, ancestry, family and community for the well-being of Aboriginal and Torres Strait Islander children and their families. And I'd pay my respects to the Aboriginal people of the Awabakal country from which I'm meeting from today. And before we start our chat today about our topic, I'll just do some Q&A, some housekeeping. So we'll have a live Q&A at the end of today's discussion, and you can go to put questions in via the GoToWebinar dashboard, which is in the top right hand, I think. And the webinar is also being recorded, and that will be available in the next 2 weeks on the aifs webinar under the webinar banner on the website. We have quite a lot of related resources and readings for you all today, and that's in the handouts section on your GoToWebinar control panel. It's a big topic and we won't be able to cover everything, so yeah, the resources can certainly help you have a deep dive into some of the topics a little bit further. We also have a short feedback survey at the end of the webinar, and we really appreciate if you can complete the survey. That helps us gauge how the webinar was in meeting your needs today, but also helps us improve and consider future areas, etc. And before we start talking about our village approach, I'd also invite the audience to recognise that there's been many children, young people and families from diverse communities with many lived experience who have become before us. And this may include experiences of pain, trauma, including harmful systemic practices, and that this is something that requires our recognition and compassion. And we respect the strengths and skills of people who've come before us and are committed to deeply listening and responding with integrity to their voices and expertise. And so for today, our topic is, we'll be exploring how a village approach can support infant and toddler mental health. And so we know that in the first 2,000 days of life, children are fully dependent on their relationships around them. And so when we're thinking about infants and their mental health, we have to think about that they're greatly influenced by the relationships with their carers, their communities, their culture, and the broader social context that they live in. So they're a little like babushka dolls. We have a little infant in the middle, and then we have layers and layers of babushka dolls around them. And many of us have heard this statement, "It takes a village to raise a child," which originated from Africa and draws from a more collective view that caring for children is shared responsibility among many of us. And in recent years, this concept of "it takes a village" was examined by Dr. Melinda Goodyear, a researcher with Emerging Minds, and there's 2 papers in the resources if people want to have a look at those. But Dr. Goodyear and her colleagues' project was titled "It Takes a Village," and it was based in Austria, and the project developed a co-designed model with parents who'd experienced mental illness and looked at promoting child-focused support networks, so how to build that village. And the researchers evaluated how the model could increase access to prevention and early intervention for children, reduce the impacts of intergenerational vulnerability, and it also looked at how collaboration in the village can reduce the impacts of siloed practice, which can occur when we have a focus just on a medicalised or individualised perspective. So thinking about and reflecting on that research, our topic today and our webinar today really explores an approach that already, village approach, which may be occurring right here already, and our panelists have a great deal of experience and knowledge about the village approach. So our panelists' bios can be found in the GoToWebinar dashboard, but it's my pleasure to introduce Viv Kassane, the CEO of Peachtree Perinatal Wellness. Welcome, Viv. Nice to have you here with us today. And then I'd also like to introduce Amy Parker, who's a mum of 3 and an advocate for peer-based mental health support. And Amy tells me that her official title within her village is Peachy Mama, which is such a warm, embracing title, and tells me lots straight away about her village as well. So welcome, Amy.
Good morning. Good afternoon, sorry.
And unfortunately, Lindsay Healy, who is Director of Gowrie, South Australia Childcare, is unable to be with us today. And in the resources section of the webinar, there is a link to a podcast with an interview with Lindsay and our Emerging Minds Families team. And that really is a great interview which captures her perspectives on infant mental health. And Lindsay also features in our practice strategies for infant and toddlers, formulation for infant and toddlers. So yeah, there's some resources there if you want to follow those up. So to jump into our exploration of the village approach, I'm wondering, Viv, if you can share how Peachtree has a village building approach and how that promotes infant and family mental health.
Yeah, absolutely. So thank you for the invitation for us to join today. We are coming from Meanjin in Brisbane, which is the lands of the Yagara and the Turrbal people. So I quite often use the term village building approach when I talk about Peachtree and the way that we do things. And we also predominantly use a lived experience or a peer approach, a service delivery model as well. And basically to Peachtree, what a village building approach means is that although we are funded as a perinatal mental health service, what we actually do is we take quite a holistic approach to how we deliver those mental health services. So in addition to running our specialised peer support groups for pregnant women, for mothers, for fathers and for carers, we also run a lot of other things as well. We run parenting programs, mental health literacy workshops, and what we do is we actually wrap it all around with what we call our social inclusion work. So we also run things like Mums and Bubs yoga and baby song time and crafternoons, for example. And we run these out of our parent wellbeing centres. We have 3 of them located throughout the Brisbane region. And these hubs are basically places for us to centralise really helpful services and to build community for the people who are going through this pregnancy, postnatal and early parenthood time of life. And through our parent wellbeing centres, we try and reduce the barriers for people to find and access help and support that they need to help them in their pregnancy and early parenting experiences. So we all know how much that loneliness and social isolation can really impact our emotional and social and mental health and wellbeing. So we really make a conscious effort at Peachtree to try and create a space where people can feel welcome, feel like they belong, and that they can find connection with other like-minded people who are going through the same or similar experiences in this time of life. We do use a lived experience workforce, so a peer workforce. And what we find is this workforce is really effective at destigmatising mental health challenges at this time of life, and role modelling help-seeking behaviour, and providing hope and optimism as well around, you know, the challenges that can be quite normal around this time of life. And so, yeah, working with parents to create a place to belong. Often, and this is a broad generalisation, but infants can be unseen in maternal services, or yeah, so really it's essential in our perinatal mental health service to make sure that we really remain vigilant in being able to see the baby, because infant mental health is really focused on you know, those early relationships that they have with their parents. So by wrapping a village approach around parents, we're also wrapping a village around infants and children, and that's really, really important.
Yeah. And Viv, you know, that you know, it's quite a comprehensive service, Peachtree, in the model that you provide. And as you said about the, you know, it is easy for infants to be lost, and particularly when we might have an adult individualized kind of framework. And so it sounds like Peachtree kind of keeps circling back to what does this mean for infants as well.
Yeah, absolutely, and it's always being conscious of, you know, actively reminding ourselves that the infant is included in this work and is a little person all in their own rights, and actively reminding ourselves to always keep baby in mind.
Yeah, thanks, Viv. And Amy, how important has that village been for you and your children in the early years of parenting?
Oh, that's such a good question. And I have so much to speak to my experience of raising my children in a village. I originally come from the UK, and when I first found out I was pregnant, I knew that with pre-existing mental health challenges and having no direct family members around me to support me, that it was going to be really challenging. I first engaged with Peachtree and their services when I found myself, after a few weeks, stuck between four walls with a brand new baby. I felt really sort of lost in over my head. And when I first went to Peachtree, I discovered the actual practical concept of what a village was. I went into a room of mothers from all walks of life, sat in a room together, all feeling similar. You know, there's really nitty-gritty negative postpartum feelings and struggles, and there was a natural flow about wanting to support each other in that space, hold space for each other's voices, and just come together and support each other. I think there was a natural instinct within us, a maternal instinct, that we just wanted to help and learn from each other about how to raise our children, elude the mum guilt. I guess being with Peachtree for several years now, I guess I'd like to share a couple of experiences that really encapsulate what a village has meant to me and my family. Is that all right?
Yeah, that'd be awesome. I think it's great to hear, you know, the practical ways and the emotional support. So yeah, any examples would be great to hear, Amy.
Okay, so I remember after I had my second child, my son, one of the peachy mums set up a meal train online, which is a service that you can, as a person, volunteer your services to cook meals for somebody, a recipient of that meal train. So one of the mums set that up, posted it in Peachtree social media group, and for the first 6 weeks of my postpartum with my second child, I had complete strangers coming to feed me and my family, leaving meals at the door for me. And that was just so kind, and the selflessness about it, that we were just all in it together and all there for each other, even if we didn't know each other. Another example I'll share is a dear peachy mum friend of mine went through some really rough stuff with an infant loss. So I'll try not to trigger anybody with this, but when she had that infancy loss, a group of us rallied together to set up a WhatsApp group called the Blank Village, where we all coordinated support for that mother, and what that looked like. So I personally volunteered to cook meals and bring them around to fill up their freezer, so that cooking wasn't a worry. Going through that period of grief and all those huge emotions. Another person helped set up flowers for a funeral. Another person offered childcare, and it was just a way that we came together to coordinate support around that mama and her really rough time. So that to me encapsulates exactly what a village is we're just all in it together and all there for each other.
Yeah, and it really strikes me, Amy, about the mutuality and reciprocity of that. So, you know, you're in terms of what you're receiving, but also in what you're giving back. And Viv, you mentioned before that it's a place that gives hope, because I think, you know, that period of adjustment, and when there's, you know, such challenges at times in that period of adjustment for all of us, it's a huge period of adjustment, but loss or isolation can add vulnerability to that as well. Viv, do you want to share kind of your perspectives on that reciprocity and mutuality that you think is a part of the village, or that you've created? What safety creates that? Or
so thank you for sharing that, Amy, because I love hearing that, because that's kind of what we do at Peachtree. So obviously those mothers have gone off and done that village building stuff together, and all Peachtree did was facilitated the connection and provide kind of, I guess, the platform and the opportunity for that connection to happen. So it really is heartwarming to hear those stories. Look, I think a big part of peer work, I suppose, peer practice, is mutuality and reciprocity, and I think they're really lovely ways for you know, sharing respect, sharing stories, the idea that we're both giving and receiving support, so it is really validating as well, and empowering, self-empowering, to feel like, hey, I'm also helping somebody here, and there's value in that, there's self-value in that for me. You know, mutuality as a peer worker is just acknowledging as well that power balances do exist in this relationship, and so acknowledging them and trying to build trusting and supportive relationships in a really fair and equitable way, and really acknowledging that you know, by allowing the space for mutuality, by allowing curiosity, by allowing vulnerability, by allowing respect, that we're all getting something out of this.
Yeah, thanks, Viv, and Amy. Yeah, thank you for sharing, because what I think it really highlights is that your village is holding each other, is what, and you know, certainly in my work experience in social work, working in perinatal and infant mental health, you know, theoretically around infant mental health, we're aiming to hold both parent and child and hold the needs of both. And I think what you have both just described is beautiful examples of villages holding both parent and child, and that it's so powerful for you know, nurturing infants' mental health, I think, nurturing children's mental health, whilst you're also holding the parents' well-being and needs in mind as well. And Viv, I was wondering if you could share a little bit, you know, there are barriers, I think, sometimes and challenges for, you know, you mentioned stigma, and you mentioned, and certainly in my experience, there can be a sense of shame about reaching out. There's a lot of pressure on parents now to think that we need to have it all together, and there's a lot of pressures on what social expectations there are about how we parent. So why do you think that connection and wraparound of social inclusion so important in that in this period particularly? Do you think it's particularly important?
Yeah, absolutely. And you're right. I think we as a society have progressed a long way in the last decade in terms of destigmatizing mental health and normalizing, reaching out when you need it. But unfortunately, I still do think stigma is still over prevalent in the perinatal and infant stage, and probably more so from a self stigma perception specifically. What we find, is perinatal mental health needs are along a continuum of care, which means that we really see, parents who may have had previous mental health experiences and, maybe, exiting out of inpatient care, quite familiar and used to mental health language and treatment, that type of thing, and feel more comfortable using that lens. But also what we find is that quite often this is the first time that a mother might be experiencing mental health problems in this perinatal or the postpartum period. So, and she might just feel like, she's at home crying all the time but doesn't know why. And it's also very easily to externalize, the reasoning for that. It's not here. It's, it's just my baby won't sleep, or I can't, I'm not, breastfeeding isn't going well, for example. So it's, to pitch a mental health service at that cohort of people is really, you're really missing the mark. So this is why I think, a village approach, and in particular having options for the broader community to join in social activities is really important. So by running mum might not come to a mental health peer support group, but she might come to a baby song time. And what happens is, comes to the baby song time and she has a really lovely time with her baby. She meets the peer workers here. She gets a feel of the place. She looks at the brochures of our services. She, meets other people, builds that safety, connection, trust. And more often than not, then she'll go home and she'll refer herself into our mental health support services. So, I think it's really important that we recognise that continuum, and that people are all, different, and being flexible in our approach to make sure that everybody is getting some needs met.
Yeah, and I love that flexibility, because certainly I think, as you said, it's a continuum, and that it's a huge period of change and adjustment for all families. Like, we get quite a glossy view. I think you were mentioning this, Amy, before. We get a glossy view of having a baby, starting a family, but actually it's a time of really high vulnerability and can be really challenging. And that also, that connection with our baby is something that, takes time. In my work with perinatal infant mental health, certainly that was a common conversation, that this is a connection that takes time, and you get to know each other over time rather than just it's something instantaneous. Viv, I'll just ask as well, because we're talking about mums, Peachtree also provides services for dads?
Yes, yeah. So it's been a little bit harder to engage fathers, so it's still not as far progressed as we would like, but we have previously run dad support groups. Through COVID, that kind of fell down a little bit, so we've just been spending some time trying to rebuild that, and that's definitely one of the priority areas that we'll be focusing on, because it's really important. Like, a lot of fathers are also overlooked and missed in this period, and because having a baby is a major life event. It's, while women or birthing people, have the physical experiences along with that, it's a major life event. So fathers can struggle as well, as change of identity, financial responsibilities, loads of contributing vulnerabilities for them at this time as well. They need a village just as much as everybody else.
I'd just love to speak to that about the father side of things. So I feel that there's a even higher stigma, with mums needing to be okay, but there's also a stigma around the dads showing any sort of emotion at all. I think that makes it hard for them to break through that barrier of accepting their emotions for what they are and speaking to that rather than just pushing it down and carrying on with the stigma that men are emotionless shells, which we know they're absolutely not.
Yeah,
So,
yeah, I think you're right, Amy. And there's a lot of social expectations about how you might be as a man or a dad as well. And yeah, I think that's important for us as service providers, and yeah, to be conscious about. Yeah. And Amy, in terms of your experience with the group work or the different sort of avenues Viv mentioned of coming into a service, yeah, can you tell us a bit about how the group work or the groups have supported you in your connection with your children?
okay, yeah, I'll just speak to what Vivian said first about facilitating a space, and that's really important to what I'm about to speak to about the programs that I've participated in. It's the most important thing about that space that was facilitated is that it was non-judgmental, which is really important. I feel that we go in thinking that we are going to be judged on our parenting, judged on how we feel about it. There's really nitty-gritty feelings. So Peachtree facilitated a really safe, non-judgmental space for us to be able to make those connections, which I feel like is just such an important aspect of what Peachtree is about. But going back to my experiences about all the things that I've done, I call them my life toolkit skills. I participated in Circle of Security, Sunshine Parenting, Peer Zone, which I'll highlight that in a sense that it helped us be able to work on our language and how we speak to each other in our village, how we communicate, how we listen, how we validate, which those skills also roll down to how we take care of our children, how we address their big emotions in their tiny body. There's so much more to it. I think outside the basics of keeping the child alive and healthy, shelter, food, water, there's a huge responsibility for their emotion and health and well-being, which I believe I picked up the skills in the workshop, Circle of Security, especially just about making sure I'm building a secure attachment and my kids feel safe with those big emotions around me.
And Amy, it sounds like it was powerful for you to experience that alongside other people in the village. So we might be able to do that individualized in in counselling or online, but having that experience together with your village sounds like that was quite normalizing and empowering in lots of ways.
Oh, absolutely. Just having a share of what we've learned in those workshops to new mums that come into our village, just having tools to give them to help them learn how to get on board and support their kids' emotional regulation, and just how to deal with those negative behaviours, if there's such a thing.
Yep.
Negative behaviours is not, I hate the word negative, it's the way that I've been taught through the workshops is that it's every behaviour is an expression. It's something that's put out there when they don't have the words, which they don't from the first few years of life,
No, and it is it's a real skill to be able to kind of put to a wondering, I guess, as Viv said before, that curiosity about what they're telling us with their behaviour. That you said about their big emotions, and absolutely, there's so many big emotions for infants and toddlers. So I think that's a great reflection, Amy, to see that. Having that support of being able to build up our sort of toolkit of I wonder what it is that's underneath that, what sort of the need that they might be expressing in in the 20th time for that day, because they do it a lot too. So
Yeah.
it's a flustering time for parents.
It certainly is. We automatically have to become the co-regulator of everything that's going on in their world. And like I said, every behaviour is them communicating a need that we have to figure out how to meet. And the skills that I learned in those workshops were about how to meet those, how to recognise and understand what they are trying to communicate to you. Even with those skills, it's still really challenging to figure out. Young children are a puzzle, but yeah, just having those skills really helped me be able to offer that emotional and mental health support for my children.
Awesome. And I think offering it for your children, and as you said, supporting each other and developing those supports within ourselves to manage for our own well-being as well is so powerful. And one of the things that stands out for me as well, and was an area that we're going to talk with Lindsay about. So I just want to kind of link that in, even though we're not able to sort of draw on her wisdom. But I think in terms of the village, there's many parts of the village. So, Peachtree has certainly developed a strong village around it, but there's also Viv, I think you guys do some links with other sorts of services as well. Like you have a service where people might be sort of held before they link into counselling or something like that. Is that correct?
Yeah, absolutely. So again, this hub kind of model is we might not have the service here, but we've got the information and can help make that connection to that other service that might be really helpful.
Yeah. And one of the other main services that I think that is a really important part of infants and toddlers village, and certainly their families village, is, I think, childcare centres and educators, and certainly looking at the Australian Institute of Health and Welfare report for 2022, we have approximately 30% of infants under the age of 1 attend childcare, 62% of 1-year-olds attend childcare, and 72% of 2-year-olds are enrolled in childcare. So that's a significant number and a significant support. So that childcare is really a place that's central to the village, I think. And so we often might think of the village as informal supports, but I think it's helpful for us also to consider the collaboration of formal supports that might be like services. And in my experience, certainly when I'm working with families, I often I did visits to childcare so I could get educators' perspectives. They're often, really skilled at observing children and attuning to children's needs, and so it's often helpful from a kind of whole picture of children's mental health to get the perspective of educators. But I also think one of the things that always stood out for me was that it's really important for educators and families to have a really strong relationship and communication and partnership together, because I think otherwise that can feel, quite vulnerable. If you're a parent and you're getting feedback about your child, that can feel quite vulnerable. But also in terms of childcare's valuing the strengths and insights and knowledge that families bring, and also the context that they are in. Amy, I'm wondering, how important is a good relationship with educators and childcare providers from your perspective, and what helps a parent feel supported?
My children now are only child. I have 2 in school now, but over my journey, I've had 2 of my children in childcare part-time, which has enabled me to work on my own personal mental health battles, because being a full-time parent, you don't always have the capacity to do that. You really called on the needs of the child most of the time. So you know, as a parent, as a mother, I have struggled to have my needs met. By having the kids in childcare, it's on the premise that when they're there, they're going to be safe, they're going to be supported, and you know, their emotional needs are met, and there's some level of what structure you have as a parent modelled within the time that they're not with you, you know, in the centre. So I've kept a really good open stream of communication with our educators. They really do fill me in on the day and challenges that my children face, where their emotional needs are needing to be met at the end of the day. So I'm really grateful for that, and I really inspire all parents to sort of push for that open stream of communication with the childcare centres and their educators. I think it's really important. They spend just as much time with them as they do with us. So I feel like that should be on the priority list to make sure that there's that open stream of communication.
Yeah, an open stream of communication, and I know Lindsay has a very strong stance around that. Educators also have a really vital role in reaching out and being attuned to families' experiences, and being able to tune in to parents and offer and check in with parents rather than waiting till it might kind of be snowballed to a more crisis point. So yeah, I know she was talking very clearly about educators having such a vital role in being able to reach out and form connections and supports with parents and their attunement. So I think, yeah, it's great from a clinical perspective or from a practitioner perspective to be always thinking about those like early childhood educators, child and family nurses, speechies, OTs, like all of those can form part of our village, and that having those relationships is really, really, again, about centering the child's needs in there as well. And thinking about some of the barriers for families, I was just wondering, Val, if Viv, if there was a particular mindset or that you would recommend for a practitioner in terms of when they might be assessing and engaging with families, that would help them sort of understand the barriers or the vulnerabilities. Is there, what might help practitioners, some kind of practical strategies, or what perspectives are important?
Yeah, look, I think there's a clear standout, and I think it doesn't matter if, you're a lived experience practitioner, or you're working within a clinical or medical model, or whether you're an educator or what. I think the common thread between all of those disciplines has to be trauma-informed care. And I think if we're all working from that perspective, then we're going a long way towards creating an environment that's going to be really responsive to human beings as being human beings. So at Peachtree, we use trauma-informed principles basically as our guiding principles for our organisation, and we use that as kind of, I guess, pillars or guideposts in terms of any decisions that we're making in terms of, operationally within the organisation, but also about how we deliver services. So, if we think about those principles of safety, trustworthiness, choice, collaboration, and empowerment, and how we think about that and how we apply that. So we do that at Peachtree right from the moment that someone walks through the front door. How they're greeted, how they're welcomed, what the physical space looks and feels like. For some people walking through that door, that was a really hard thing to do. So the way we greet and the way that we want people to feel welcomed, and we want them to say, hey, we're really glad that you walked through that door. So first and foremost, that. In terms of how we practice, it's active listening, so being really present when we're talking with parents, not being distracted by phones or you know, you have our attention, and not trying to fix. We're listening to learn and to understand. When we're not listening to try and fix you, and really, you know, we kind of don't prescribe to labeling here, and as well, so you don't need a diagnosis, or you don't need
Yeah.
you know, a mental health care plan or anything like that to access your service. If you're someone who's identifying that you need help, then we're happy to help you. So it's about reducing that barrier. I think other things about how we apply trauma-informed care is using strength-based approaches. So unfortunately, like in the perinatal and infant period, there is a lot of deficit-based language around, so you know, failure to thrive, that type of thing. So we make a really conscious choice to making sure that we're using positive language, and also reframing experiences as well, so that they're not looking at the failure or the deficit of a person. So, you know, we use Circle of Security a lot at Peachtree. Not only do we deliver it as a workshop to our community, but we also use it as a shared language across our staff. So we use a lot of circle language in the way that we communicate with each other as a team, and the way that we communicate with our community as well. So so we've all a shared understanding. And luckily for us, you know, lived experience work really naturally aligns with trauma-informed work as well. So key peer principles such as you know, being person-led, self-determination, so recognising that people are the experts of their own life, and are the best place to make the choices and the decisions for themselves and their infants and their families, whether we agree with them or not. And you know, as in practice, that can be a really delicate line to balance in terms of assessing dignity of risk versus duty of care. So there's, you know, complexity and really being able to sit in that discomfort of people owning their choices.
Yeah, and I think it really that really resonates with me, in that sense of you know, the dignity of risk and managing risk and people's self-determination. And you know, having worked with women and children around family domestic violence, that's something that was, you know, there was significant isolation, and there was a need for a village, but I also needed to respect the pace of, you know, mum's choices around, you know, being able to reach out or connect with family after they've left violence, or, you know, so there's, again, I think, you know, as you said, that person-led, going at the pace of the person and respecting self-determination, and at times having ethical challenges around that, is something that, we definitely need to reflect on. And that's certainly an important skill from, you know, I think in terms of infant mental health, it's that always coming back and reflecting on what does this mean for an infant, but also, you know, weighing up all of those things and holding them and getting support to hold them, I think, so that you have a village around. Like, as a practitioner, I would say you need a village around you as a practitioner to support people in their village as well, because it's not a one person to do it.
Yeah, absolutely. You know, we come across really challenging, you know, people who are facing really challenging circumstances, and you know, I think we're naturally drawn to this work as well because we're empathetic and we want to help. So, you know, I think it's really, really important in that respect that as an organisation that we've got really robust organisational policies and procedures, and you know, at a governance level, but that feeds down into staff as well, so that they've got a really comprehensive understanding when they come across these, you know, circumstances, that they know how they're expected to respond and in those situations. So training and ongoing supervision for workforce is absolutely essential as well. And you know, that community of practice and debriefing and all of that is part of that, I guess. Yeah, the practitioner village.
The practitioner village, absolutely, and the and that helps have in safety for the village in general, and safety for the well-being of everyone. And I'm conscious that we're about to move probably to our Q&A time, but Amy, can I ask you, and then I'll ask you, Viv. We spoke about quite a few areas about the village approach, and I really appreciate both of you sharing your experiences and insights. What would be your take-home message for the audience before we move to our Q&A? Amy or Viv, whoever would like to go home. Go home. go first.
Yeah, I'm happy to do that. I just wanted to say that this is all parents. You don't have to do it alone. There are supports out there, non-clinical textbook support in the form of peer-led constructs. I think there needs to be a destigmatization of all of those hard nitty-gritty experiences of parenthood. And I guess I just want to say there's a village for everybody. Like, we're all individuals, and that looks different for everybody, but there is a village out there for everyone.
Yeah, lovely. And I think such a powerful message. Thanks so much, Amy. It's been great to hear your experiences. Viv?
Yep, so I think my key message is to everybody is just to stay curious. We're constantly learning. Parents are also constantly learning, so we need to be patient, we need to be kind. Like Amy mentioned earlier on, we need to drop the judgment, leave that at the door. No one's going to come back to your service if they feel walking away feeling like they've been judged. I think as services practitioners, we need to embrace the role as being a connector and building support. So even if that's not what your service or business does, it's maybe just that responsibility of knowing what's out in your local community. And at Peachtree we keep a little database and spreadsheet so that when we hear about things like library groups or swimming clubs or those types of things that we've got notice boards and things like that about putting that information up. So
yeah, being connector, I think that certainly is key for infant mental health connection. So kind of again is those babushka dolls out and out and out, full of connections. And so we had a lot of questions some pre-registration questions, and also some come through our webinar chat. And we'll also record at the end of this session, we'll record some additional questions which will be in the recorded version. So if you, when you get the link, you can access that as well. And one of the questions for Viv was, are there legal services included in the wraparound services at Peachtree?
Okay, not at Peachtree specifically. So we predominantly just provide services around social, emotional and mental health and wellbeing. But legal services would definitely be one of those referral pathways that we make sure that we have in place. And legal services is usually quite expensive and a barrier for people as well. So Women's Legal Centre and places like that are all in our referral database.
Yeah. And these two questions are probably linked, and it was, how do we promote the importance of families accessing wider community or village? And were there any tips for practitioners on how to start to help people to build their village? And I think, we spoke earlier about isolation, and certainly as a practitioner, my sense is that when I'm undertaking an assessment, I always ask people who is important in their life, and so that might start with families and friends, but and then looking at if there's a broader kind of, you know, do you attend groups, or what's, yeah, the barriers to what might be linking out. Amy or Viv, do you have any tips, or how do you promote that importance of connecting in?
Okay, when we become a parent, we automatically become a child's advocate, whether we're aware of it or not. Our children have a very little voice in this world, and it's really important for us to speak for them. Even though they can't really advocate for themselves, they can communicate their needs to us. It's really important for us to pay attention to those cues that they put out there and create a world and spaces for them to feel safe and feel heard. That's why the village is so important. It creates that world and that space to which is kind of custom built by our children and individual needs that they have to be met. We create what they need around them. Generationally, we're taught children were to be seen and not heard. It's taken a lot of work to get to a place where children are being seen and heard, even when they don't have a voice.
And Amy, that's a really, such a lovely infant-focused perspective. And I think that is often a starting place for a practitioner. And I would often call that, and in our courses, we have some tips around this, is speaking to or for the infant. And so, as you say, they're expressing needs, or we're being an advocate for them. So as a practitioner, sometimes it's helpful to, speak, be in a curious, as you said, Viv, it's always from a place of curiosity and strength rather than of judgment, definitely. But being curious about what it might mean for, this little person, if you were to maybe, step out of your comfort zone to do this or to do that. And so it's such, our children can be great motivators, and exploring for what it might mean for them can support people in that process of, taking that step when it may be really vulnerable to reach out or connect with someone. It's not always easy for us to form those relationships, but having an infant focus is really often a great, parents are so often wanting to do the best by their children. Viv, did you have any other tips? Or Amy, sorry, I cut you off there.
No, you haven't at all. Go ahead.
Yeah, Viv, any tips?
I think you kind of covered it, because I was going to say it's about, as a practitioner, it's active listening and curious questioning. So again, someone's walking through the door, help seeking, it's not here to go, okay, well, you need this and you need this and you need this. It's active listening to what people are experiencing, what they're going through, curious questioning, and then having the information and resources available to give them.
Yeah. And certainly, again, from my perspective, it's that, often when we're talking about connecting with a village, we're talking about our relationship skills, and that's not always something that is easy for each of us as humans. And so we'll all have different relational styles, and it's really important, I think, to be conscious of, have a self-awareness of our own sort of assumptions and bias, but also, bring forth what it means for that person to be relating. And I'm getting a question hot off the press, so if we can't get to it now, we may be able to get to it in the recording. How can practitioners encourage other practitioners and professionals to recognise the importance of social connection as opposed to focusing on medical models and diagnoses? It's a big question. I'll name that first up. We've not got a lot of time, so it may be one that we address afterwards. Is there any first response that you'd like to make, Viv, or shall we put that in the recording afterwards?
Look, it is a big one, and I'm happy to speak more in depth about it. But just very briefly, I mean, it's a hard job. I think, currently parenthood in general is very over medicalized and over pathologized, and I think it's just going to take time and commitment that we just have to keep advocating for this approach, and hopefully over time there will be that shift in culture about the way that we think about parenthood.
Yeah, and from working within, health systems and mental health systems, I know that, that it can be very task focused and medicalized in terms of, and so often I think, it is really important to come back to what does this mean for the infant? And every time we come back to what does this mean for the infant, that in some ways means that we start to think about relationship. And what does that mean for a parent? If we're only looking at the medicalized sort of symptoms and function of an adult, then we're not thinking about what does this mean for their parenting? What does this mean for their day-to-day life? And certainly our courses, Practice Strategies for Assessment and Formulation, both give quite a few strategies around how to discover the infant's experience, how to have some more in-depth conversation with practitioners and with your multidisciplinary team about what that means for the infant in terms of not just a medicalized perspective, but what it means socially for that family as well. So taking a bigger picture, and I think it is a chipping away at the system as well. Yeah. And Amy, is there any would you like to offer any comment about having a bigger picture than just being a label or being medicalized?
I'll just speak to what about practitioners and clinicians. So obviously I've said Peachtree was the first sort of peer-led construct. And initially it was really intimidating because I had been through so many services, practitioners, clinicians that do go textbook clinical medical support. And often for those appointments I would turn up with my infants, and they you get the feeling and the vibe, I guess, of that they're not supposed to be there, even though they are part of that support, needing that clinician, needing that practitioner involved with them, but it feels like they shouldn't even be in the room and I shouldn't bring them along. So with that space with Peachtree and a couple of other not-for-profit organisations I've linked in with, there's a space created in that peer-led construct where the kids are included in that, even if it is a clinical reason that you're there, or a practitioner involvement,
Yeah, and that's, it's so important, Amy, and it makes me think of some of the systemic issues that really are a point of advocating. Practitioners can be an advocate for, for example, having a parent who may need to be hospitalized postpartum, and negotiating with systems when there's not mother-baby beds available, negotiating with systems around how we can support them to keep feeding or breastfeeding. And so I think there is a role of advocacy for practitioners to be, one, thinking and reflecting on what does this mean for this person in their role as a parent, what does this mean for this infant, and how do we in some ways look at how systems can be more responsive and flexible to the needs of that period of life, is so important, I think.
Peer-led is lived experience, and I feel that the only way that we can break through those barriers with practitioners is if they really do set their mind and their head into what we are feeling within and how the situation that we're in, to be able to support us. Put yourself in our shoes.
Yeah. Thank you, Amy. I think that's a perfect spot to draw our conclusions before we do a little wrap-ups. Thank you so much, Amy and Viv, for sharing your insights and wisdom and knowledge today, and for giving us such great examples of a village approach here, particularly in Queensland, but also that can be in other areas as well. And just to finish up, there will be a survey that will pop up. If you can complete that, that would be fantastic. Thank you to our audience for fitting us in at lunchtime on a Wednesday. And you can get the recording and the additional questions in the next few weeks. Our next webinar is coming up in, is a CFCA webinar, and it's from the Evidence and Evaluation Support Team, and it's on customer journey mapping and what it can tell us on the 17th of April. And there's also an AIF conference coming up in June, and we'll showcase some important research for the wellbeing of families across Australia. And that registration is still available for early bird registrations the next couple of weeks. So we'll add to the AIF's list of topics how to make systems flexible for the perinatal period. So thank you so much to everybody for joining us today, and thank you for your engagement with the questions. And Amy and Viv, yeah, I'm incredibly grateful for your time with us today. Welcome back to our Q&A recording for how to build a village around infants and toddlers to support their mental health. One of the questions that we were going to look at for the Q&A is, what are some of the supports or additional barriers, for example, you know, where there has been adversity, what supports might be needed for a family to be able to engage with a village? Viv, do you have a perspective? Because it's not always an easy, straightforward, linear process.
No, and people are very diverse and have a very diverse range of experiences as well. So what we do at Peachtree is that we really collaborate and build a collaborative relationship with parents to be able to meet them with where they are where they're at that particular time. And we try and minimise and reduce barriers as much as possible. So, you know, we are fortunate to have funding, so it is a free service, so that financial barrier is removed. But also we don't have any time limitations on our service, so people can dip in and out of the services they need. So we know that, you know, adversity doesn't necessarily stop just because you've reached the end of your 10 sessions or the services ceased, and children continue to grow and develop and have needs. So at Peachtree, we don't have any time limitation on you being able to attend our service. So some mothers have, you know, been with us on their journey of multiple pregnancies, and they come in and out of that service as they need, and that they feel that they need that extra support at that time.
And that's really strikes me that, you know, each period of change in infants and toddlers and multiple pregnancy, there's a whole range of different needs, and having consistency and a holding environment is really conducive to infant mental health. Was there anything that you'd like to add, Amy?
Yeah, so Peachtree specifically concentrates on the first 5 years, but it doesn't end there. So I've been with Peachtree for 6 years, ongoing. I still have a few years to go. Yeah, hopefully I do really well and don't need their services anymore. I'm so blessed to have had everything that I've gotten from them, and that safe space without barriers, and also being able to help me engage with other services and, you know, within the mental health network, to be able to help that support go ongoing, because I feel like it's a lifelong journey, and that's one of the barriers that you get with mental health support services for yourself and your children, is that it's just a short-term band-aid. There's not that ongoing support that we need, because we all have ups and downs, which is, you know, with Peachtree, I will come in on my good weeks. I won't engage with the services at all. I'll socially connect with my peachy mamas, and then When things are starting to feel a bit of a challenge, that's when I'll re-engage. I'll go to yoga and have a coffee and have a chit chat with others that are struggling. Maybe make myself feel better by instilling what I've learned to other mums that are going through struggles that I've been through.
Yeah. I think, that's such an important reflection and comes back to where we started at the beginning of the webinar around, having supports that are not siloed, that there's a continuity of care. And Viv, you mentioned going from pregnancy through having that continuity from antenatal, if people are able to access, is such a powerful protective factor for infants when parents are able to get supports antenatally as well. So that may be another way of reducing some of those barriers, is to get in even before Bub's born sometimes.
Yeah,
I'd like to speak to that, actually. Sorry, I just want to interrupt.
Yeah.
One of the biggest regrets I have in my journey is not engaging with Peachtree services sooner. I was first introduced to them by a social worker at the hospital in the maternity outpatients with a leaflet with a picture of the logo with the tree on the front, and everything was so overwhelming. There were all new feelings, and I didn't know how I was going to engage with it. And in my head, I was like, this is another clinical service. I'm not really optimistic about where this is going with supporting me. I was so nervous, and it felt really intimidating having that. But I really wish I'd had engaged with them prior to the birth, because I had that first few weeks of my experience as a new mum, completely isolated, completely alone, not knowing what to do, where to go, who to reach out to. Sorry, just thought I'd share that.
Yeah, and that resonates with many, many mums that I've worked with antenatally and postnatally, is that if you can get supports antenatally and and you can create relationships and safety, then that's really powerful to be supportive throughout your postpartum period as well.
Yeah, like I said, it's hard to ask for help. It's hard to give yourself permission to admit that you need help. So anyone who walks through our door, we work from the basis is that this has been hard, well done. We're so glad that you're here, and also referral processes as well. So if I can speak to that, so we do take like health professional referrals, but it's not necessary. So parents can actually self-refer into our programs, and sometimes we might get those health professional referrals through as well, and it might take us more than a few attempts to actually build the relationship with someone to the stage that they feel comfortable to walk through the door. So we don't have to put pressure on people, or to come here. We're just a gentle nudge reminders that, hey, we're here, we'd really love to see you.
So allowing it to evolve rather than feeling like a pressure. And again, it's that time and relationship sounds like it's so important.
And we hear, similar things to what Amy has expressed all of the time. And it's about how reassured people feel when they actually realise that they're not alone in these experiences.
Yeah. I don't think we can ever underestimate and the importance of that in that early isolating period of being at home, as you said, Amy. Thank you, Amy and Viv, for sharing your insights again today and for offering us this additional time. And thanks for our audience for watching us and sharing the experience of the village approach today.
Thank you.
Thank you so much.